Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, the link between suboptimal vitamin D nutritional status and severity and mortality from COVID-19 has become so strongly tied together that on February the 8th, 2021, a position statement from the Spanish Society of Geriatrics and Gerontologists published their recommendations entitled Vitamin D Supplementation for the Prevention and Treatment of COVID-19. Quoting from their position statement, they indicate that COVID-19 produces severe respiratory symptoms such as bilateral pneumonia associated with a high rate of morbidity and mortality, especially in patients of advanced age. Now, at this time, they state that there's no known active treatment for the virus, but corticosteroid drugs and biological immune modulators are being used to treat the inflammatory phase of the disease. With respect to vitamin D, they state that vitamin D receptors are expressed on most immune cells, including the B lymphocytes, the T lymphocytes, the monocytes, the macrophages, and the dendritic cells, and that vitamin D stimulation of these immune cells produces anti-inflammatory effects, which helps suppress the cytokine storm that typically causes death to occur in advanced COVID-19 cases. They also reinforce the fact that vitamin D is also required for certain immune cells to fully mature and respond in appropriate ways to help ward off and fight viral and other types of infections. They state that in this context, some studies have reported that vitamin D treatment could be useful for the prevention and treatment of COVID-19. They go on to state that some preliminary studies have already shown very promising results with vitamin D supplementation in hospitalized COVID-19 patients. So they cite this meta-analysis study showing a lower death rate, a lower mortality rate in hospitalized patients given vitamin D supplements compared to the controls who were given a placebo. They also cite these two retrospective studies showing a decrease in the clinical symptom score in the patients treated with vitamin D, and a third study demonstrated a lower rate of admission to the ICU, the intensive care unit, for the COVID-19 patients in the hospital who were given the vitamin D compared to the placebo group. A fourth study cited in the meta-analysis showed a significant decrease in serum fibrinogen levels in COVID-19 patients given vitamin D supplements. So as a rule, lower fibrinogen blood levels translate into a lower risk of developing abnormal blood clots and blood vessel inflammation. Another study, as I reported on last week, showed that patients with low blood levels of vitamin D who were administered vitamin D supplements within 1 month before contracting COVID-19 had less severe symptoms, better recovery, and a lower risk of mortality than patients identified with low vitamin D blood levels who were not recommended to take vitamin D by their doctors and who subsequently contracted vitamin D within the next month. Their outcomes were much worse. Now, previous studies have indicated that the risk of developing many types of severe infections is much lower if you have a blood level of vitamin D that's between 80 and 140 nanomoles per liter. That's exactly where you want to be. A blood level between 80 and 140 nanomoles per liter. Most people don't have a blood level in that range. Most people have a level below 80, below 50 in fact. Based on the available evidence, the Spanish Society of Gerontologists and Geriatrics have established recommendations for vitamin D supplementation for patients testing positive for COVID-19. They say, once you test positive, we really need to get more aggressive. The vitamin D recommendations are based on the patient's vitamin D blood level. The lower the patient's blood level of vitamin D, the more aggressive is the vitamin D supplementation protocol. As an example, for COVID-19 patients presenting with a blood vitamin D level below 25 nanomoles per liter, which is not that uncommon, they recommend 7,000 IUs of vitamin D per day for the first 8 weeks, followed by 3,500 IUs of vitamin D for the next 8 weeks. The goal in these cases is to quickly establish more ideal nutritional status of vitamin D with the intention of improving immune competence and helping to prevent life-threatening cytokine storm from occurring. So I've included the comprehensive vitamin D supplementation protocol they recommend based on the patient's vitamin D blood level in the text below for those who are interested in seeing the full guidelines. I've also included the reference for this position paper in the text below. So thanks for watching, and I'll see you next time.